Here are some general recommendations for collecting evidence. Remember to change gloves between each step. Consider wearing a mask to prevent contaminating the patient's specimens with your DNA. Only use 2 swabs per site to minimize the dilution of the sample, and always allow swabs to air dry before packaging. Remember that the oral swab step is collected to obtain foreign DNA or other substances from the victim's mouth, and the buccal specimen is collected to obtain the patient's known DNA and should always be collected. Here's an example of the collection of oral swabs. Consider using sterile water to moisten the swabs before collecting. Only 1 or 2 drops of water is needed to moisten the swabs before collecting from dry areas. It's recommended that we use moistened swabs to swab under fingernails. Again, remember to allow the swabs to air dry after collecting and before packaging. When collecting dried secretion specimens, moisten 2 swabs and gently roll over the area. Perianal and anal samples should be collected using moistened swabs. Vulvar swabs should also be collected using moistened swabs. Vaginal swabs do not need to be moistened to be collected.